The King Jr. Community Hospital is once again on shaky ground. Hospital officials warn that potential funding cuts could leave them with an annual shortfall of up to $100 million. LA County leaders are taking a closer look at whether their health care funding system needs to change.
NBC4's Amber Frias joins us live now at MLK Community in Willowbrook with more on today's developments. Amber.
Hey, Jonathan, Annabelle. Well, the Board of Supervisors unanimously voted this morning to review the way Measure B funds are distributed to hospitals and whether MLK Community Hospital should get more money. Now, this is especially critical for this hospital because hospital leaders say they are currently in a financial crisis. A unanimous vote by the Los Angeles County Board of Supervisors could help determine the future of Martin Luther King Jr. Community Hospital. Supervisors have ordered an independent review of how Measure B funding is distributed after hospital leaders warned they're facing a growing financial crisis. The board's decision could have far-reaching consequences for the people who depend on South LA's MLK Community Hospital.
Mucha gente que no tenemos seguro o un papel que tengamos que nos ayuden económicamente.
Marcelo Arredondo is a Medicaid patient who relies on the hospital for care and worries about what would happen if it were no longer there. MLK Community Hospital opened in 2015 to restore healthcare access in South LA after the closure of King Drew Medical Center. Now, more than a decade later, hospital leaders say the need has grown far beyond what the hospital was built to handle. They say, like Marcelo, 95% of their patients either have Medi-Cal, Medicare, or are uninsured. Hospital leaders say that growth, combined with expected Medicaid funding cuts, could leave the hospital facing an annual shortfall of up to $100 million. Now, they say the answer isn't another bailout like it's received in the past from the county and state, but a permanent funding solution.
So that's what's at stake, is people not being able to get the care they need, people getting sicker and dying sooner.
The supervisor's vote doesn't immediately provide new funding. Instead, it launches an independent review of the decades-old Measure B funding formula, which currently only provides funding to county trauma centers. MLK is privately owned and doesn't have a designated trauma center.
Every year, hospitals that desperately need funding, like MLK Community Hospital in the 2nd District, which doesn't qualify for ongoing Measure B funds, are forced to compete for one-time funding to help keep their doors open.
For now, patients like Marcelo are hoping the county's review leads to a long-term solution because for many like him, he says this hospital is their only option for care.
No van a tener que, si no tienen recursos, como cubrir sus medicamentos, sus citas, pues claro que lo va a afectar mucho.
And that independent review that the Board of Supervisors have requested needs to be completed before 180 days. And then after that, the Board of Supervisors will meet again to review the findings and talk about next steps. Reporting live, Amber Frias, NBC4 News.
Amber, thank you. Let's get an update.